So I have my own genetic story, and for some of you who are here in the audience the last few days, I did mention that I'm an identical twin, although one allele is different, and we'll be getting into that. And so I've always been fascinated by genetics, and probably if I didn't do so much of it and some research in college before I went to medical school, I might not be up here today because I probably would have gone the molecular genetic route instead of the hypothalamic, pituitary, gonadal, adrenal, reproductive endocrine route. I want to talk about the evolution of age management medicine, or what I like to think of as personalized or precision medicine. In fact, that term feels right to me, and I've been searching for years for a term that really fits what we're trying to do, because in one form or the other, I've been practicing this kind of medicine for over 20 years. Initially, it grew in parallel with my work in clinical research, which was the first 2/3 of my career. And then subsequently, I ended up feeling that we weren't applying a lot of what we knew, as Elaine pointed out, to the reality of patients. And we were practicing in a way that was a one-size-fits-all, and yet one size doesn't fit all, even my twin and I. Currently, she's a little thinner than me, so she's very happy about that. Okay. In terms of age management medicine and genetic testing, I'm going to go into the role of clinical practice and reconciling genetics with hormones and metabolism. And then genetic testing services, just briefly. This is one. Oh, you switched it? Okay. Good. I'm going to talk about examples of clinical application as well as epigenetics, and then summarize. Epigenetics is a whole new field that has been around for a while, but is beginning to help me make sense of why you can see a whole family who's genetically positive for diabetes and the same gene, and yet one has florid diabetes and the other one doesn't. And that's always been troubling to me throughout my career. So this is where my genetic story began, although I don't have the baby picture. I'm never very sure which one I am as a baby. I usually have to sort it out with my mother's help. I'm not sure she knows, but always. But I think I'm the one on the right there as I'm facing the baby one, and I know I'm the one on the right in the blue shirt when we were in our teens. And that's my sister Harriet. So to turn to the evolution of medical profession, the way I see the future here, and I think it's beginning to happen, is we all know, I think, in this room, right, by raise of hands, what a hospitalist is. Correct? People know what a hospital, okay. And we know because medicine has become impossible in the last decade or more, when we as doctors were supposed to be seeing 20, 30, 40 patients a day. How were we supposed to make rounds? The new knowledge, the explosion of knowledge, the aging population with demands as they enter a hospital and being sicker. So hospitalists came to be. But I would say when I ask patients if they know what a hospitalist is, I would say only about 25% of them are aware that either a practice group, at least where in the various places I've been, have a hospitalist in their setting, or they refer once a patient gets to the hospital and they try to work in sync with that doctor. I see us in personalized medicine as the opposite end of the scale, 180 degrees. And as you can see, the age management medicine doctor optimizes and advises, and I'd like to think of as a guide to where we're going in the future. In between, and I just use primary care as a placeholder for everything else, and I believe it's very important to work with patients in a way that focuses on their risks and then develops a plan for them, because we're all going to age, and that's a good thing, because if we don't, we're not alive, right? But we want to age healthy. And the way I think about it, and this field, when I speak to the doctors who are not adopting this concept at all and are very resistant and angry about it, I talk to them about healthy longevity. There's no way any of us could predict if we're going to live forever, but wouldn't it be nice to die quietly in our sleep when our body is just about worn out, but stay healthy as possible until then? What age management medicine isn't is concierge medicine. Now, I know this quite well, but unfortunately, in the beginning of my career working in this field, I had to do a lot of concierge medicine because it didn't exist, the kind of approach we use. Today, we still have no choice. There's some aspect of it because medicine is so fragmented and there's so many silos of care patients hardly know where to go, what to do, even doctors. Probably a good 50% of my practice are other doctors. And we talk about this, what is exactly the type of specialist somebody might need. So concierge medicine really emerged because of deficiencies in our current healthcare system, and it leaves gaps in patient care. And that we're not going to tackle very quickly, very soon. I think age management medicine, or we as physicians who choose to practice in that way, has to assume elements of concierge care, both for clinical and business reasons. I don't know how many of you do this, but my patients have my cell phone and my email. And even though I ask them to email other folks in my practice and on my team, because we get so many of them, they expect answers. In fact, they're very well trained, though. There are, I would say, maybe 10% of them, right, guys, who call us and email us all the time. But the others realize that we're professionals, we value our time, and we want to work with them in a reasonable way. So I feel very lucky. To grow good medicine and to get to good business practices, to me, it starts vitally with medicine. We are healers, all of us, whether we're MDs, DOs, PAs, nutritionists. And I think we have to put medicine before business. And while it's very tempting to go into lots of new areas, and I think we've seen, some of the information in booths, I don't really see it here, but one of the reasons I've chosen never to go to A4M is because I think there's a lot of complications there, and I'd rather not be exposed to some of it. A lot of good doctors come out of there, hence Dr. Chin, but I think that there's some troubling aspects, and whenever a new field emerges, that's the case. I've been in on women's health and lucky enough to be part of the revolution in alternative and complementary care, although I don't personally practice a lot of that because I don't feel like I'm an expert. I believe as age management medicine doctors, we can refer and advise and work with our client patients to really get the best and the most out of their health so that they can enjoy life to the fullest. So for age management medicine and genetic testing, it can encompass a lot. And beginning with the medicine, as you'll see a little later on in my talk, it can grow into a business where you become a vital part of advising and consulting. And after all, that's what we're there for. If the trust grows and the relationship, which is the heart and soul of medicine, is there, patients grow to trust you. I like to think of it as they may be paying you for your brain, but they're actually praying for your heart. And I like to think of my patients as my relatives, well, at least the ones I like. And so those are the ones that when they give you a quick call and, hey, listen, I just heard this from the doctor, what should I do? You feel their pain. So that's where I still am when I talk to my patients.